Good afternoon, I'm Patrick Pilch. I'm the leader of BDO's Healthcare Consulting Practice and co-founder of the BDO Center for Healthcare Excellence and Innovation with my colleague and co-founder of the center, Dr. David Friend.
And yes, good afternoon. I'm Dr. David Friend, as Patrick mentioned. Patrick and I run the BDO Center for Healthcare Excellence and Innovation, and it's a pleasure to have the chance to speak with you.
Yes. So David, we are in Boston today. Last week we were in DC. A lot of what would be helpful if we could level set what's happening from the shift of policy from the previous administration to the current administration, and how does that translate in for healthcare reimbursement and strategy and for providers and investors?
Sure. So we are doing this recording. Today is, I guess, April 11th, and it is our expectation that when Congress comes from recess, believe it or not, they are going to go after healthcare again. And we believe strongly that in order for the president to fulfill his agenda on tax reform and on infrastructure, they're going to need to find a way to get a health care bill passed. So our first point to you is we don't think health care has gone away, we think it's coming back. If we look at philosophically, we'll just talk philosophically for a minute about what we think is the difference between the previous Obama administration and the Trump administration. And if you want to think about it, you think about it in three ways. The Obama administration really, as a philosophical basis, believed in three things: mandates, subsidies, and the power of regulation. If we look at the new administration, they're really looking at things differently. Instead of mandates, they would prefer to go with choice. As opposed to subsidies, they would prefer to go with what they call actuarial soundness, using tax credits, or there's an expression up here in Boston at Harvard that every tub has its own bottom, meaning that people should pay for the expenses they generate. So instead of subsidies, we're talking about actuarial soundness. And the last thing, as opposed to an emphasis on regulation, you're going to see an emphasis on competition. And so those three changes, moving to removing mandates with choice, removing subsidies with actuarial soundness, and removing regulation with competition, is going to be something you expect to see as the administration unfolds healthcare.
That's very helpful. And when you think about that from a policy perspective, that's one aspect of what we look at from the center perspective. We look at financial expertise and clinical integration data in a policy framework. Ultimately, there's a market force drivers here. What are those big market forces that you're seeing occurring right now that will continue some time and have some legs to them?
Sure. So we believe there are really 5 revolutionary forces now in medicine that are going to impact patients, that are going to impact everybody watching this video. And government is either going to act as a brake or an accelerator on these issues, but these are the issues, these are the forces that are just driving healthcare. The first one is there's a convergence of molecular biology and computer science. Increasingly, we understand that a lot of health issues are DNA-driven or software-driven, and so this conversion of understanding how software and computer science work with molecular biology is going to be very powerful. For example, some of the issues that the Food and Drug Administration are going to have to deal with are going to include new medical devices that use software. Those are going to have to be regulated. Looking at, for example, taking medicines and having the technology to decide and see, did the patient actually take the medicine? That ability to monitor remotely patient compliance will be an issue that the FDA will have to deal with. So this kind of, another issue will be using our mobile phones more, using more healthcare from apps. Those may well be regulated by the FDA. So it's this convergence of molecular biology and computer science. It's the first force. The second force I mentioned is just the emergence of mobile technology. Increasingly, healthcare is going to be mobile. We're going to use our iPhones, our iWatches, other technology that hasn't yet been invented to enable patients to get care anywhere, anytime. The concept of right care at the right place, at the right time, at the right cost is going to increase, and the ability to deliver this in a mobile setting will be very powerful. The third trend is the fact that financial risk is going to grow. Increasingly, providers are going to be absorbing financial risk. Traditionally, healthcare was a fairly safe place to invest. Most healthcare institutions made a profit. We're now entering a world where some businesses will be highly profitable. Other businesses in healthcare are going to lose a lot of money. So the risk to your financial health within healthcare is going to grow dramatically. The fourth force is we are moving towards an integrated supply chain model. Most of the rest of the economy today uses supply chains. When Boeing builds a plane, There are 10,000 suppliers who deliver 150,000 different parts to put a plane together. When General Motors builds a car, it uses a lot of suppliers to build their cars. Healthcare has traditionally been a cottage industry. That is changing. And the whole healthcare economy is moving to advanced supply chain management, and that's going to have profound implications throughout the delivery process. And the fifth force is the movement of care from the hospital to a non-hospital setting, whether it's called skilled nursing, home care, post-acute care. What is clear is that more and more care is leaving the hospital space and going to be delivered in another space. And again, a lot of it's being driven by the desire to have the right care at the right place, at the right time, at the right cost. And that is increasingly not the hospital. So this begs the question, what will the future of modern hospitals be? Where are we going to train our future nurses, physicians, and techs? And really, what's the role of the non-hospital system going to be as it increasingly takes share? Those five forces are going to occur regardless of what happens in Washington. The only real answer within Washington is, are they going to speed that up or slow it down?
No, I thank you very much, David. I think that's very helpful. The perspective that we see a lot of is when you start looking at some of the law that's put in place, set aside the ACA, there's other law in place right now, such as 21st Century Cures Act, the Impact Act, MACRA. These are going to be the real drivers, we believe, and forces of regulatory impetus and change that will move forward here. Quickly, if you could just summarize, if you're taking in the level set of the policy from the Obama administration, the Trump administration, the five revolutionary forces, and specifically where the risk shift is from the federal government and where it plays into the employers as well.
Sure. So again, as Patrick mentioned, while we've been talking about in the paper virtually every day about repealing and replacing Obamacare, what you need to know is that there are several major pieces of legislation. MACRA, which was passed on a broad bipartisan basis last year, it is not going to be repealed. The Impact Act is not going to be repealed. And these are increasingly going to drive what happens in the system. And to Patrick's point, and this will be the last point that we make, the people who are going to be taking the risk in the market are going to change. First, the federal government wants to get out of the risk business. They want to put the risk on the states, and they want to put the risk on the population. Secondly, large employers. There are about 125 million Americans who get their health care from their private sector employers, and then there are about 20 million who get them from public sector. Those large employers are increasingly going to be absorbing the financial risk, and so they're going to increasingly be self-insured. The rate's gone up from roughly 40% 5 years ago to over 60%. That will continue. So large employers are going to have an increasing role in what happens because they're going to be on the hook. Third, the providers, the docs, the healthcare systems themselves are going to increasingly be a financial risk, particularly as they take on bundled payments, value-based payments. Whether the providers understand this or not, they are increasingly going to have insurance risk. And fourth, the insurance companies, interestingly, are decreasing their risk. They want to be service providers to the entities where somebody else is backstopping the risk. One of the reasons that the insurance company stocks have been so dramatically successful, United Healthcare is up over fivefold, is that they're actually moving out of the risk business and developing more steady streams of income. So for those of you watching this video, increasingly you're going to be taking the financial risk, and you're going to have to understand it and be prepared for it.
Thank you, David. Hope this was very helpful to you, and look forward to continuing our conversations with you.